The main area of research that I started in my PhD program was around cancer care quality. So I was, taking care of patients in the adult bone marrow transplant setting. I was seeing that after they were discharged from the hospital or around that time of discharge, they felt very unprepared to go into the home setting where the follow-up would be very intensive. That's really where I become really interested in the caregiver piece, because there's so much that we focus on, of course, with the patient. And the caregiver really is that link between the patient having their optimal health outcomes in bone marrow transplant or oncology once they transition back into their home setting. And the caregiver really, as I see it, is like a social determinant of health. We have a broad understanding that there needs to be more interventions to support older adult cancer survivors and their caregivers, but we don't really know what works and we don't really know how to implement it. What this research project is going to do is develop a model of care for survivorship after their cancer diagnosis, where a community health worker will do some coaching after they finish their active cancer treatment and monitor their signs of frailty and anxiety and depressive symptoms after they finish their cancer treatment through a series of check-ins and coaching. This is going to be a model that is tailored to the community of patients around the greater Sacramento area, where we can test this intervention's feasibility and acceptability. And then if it is found to be feasible and it does have a positive effect with patients and caregivers, we can roll out a larger clinical trial.
What can we think about it?
I saw the Family Caregiving Institute, and I saw that there was this abundance of resources and support, both really doing academic research and with policy and partnering with the state of California and other agencies to do research and collaborate, just not in an academic space, but outside of academia as well. So I saw UC Davis and the Family Caregiver Institute really as an innovator. I'm very excited that I have the opportunity to be a Paul Calabrese K-12 scholar at UC Davis, to be the first nurse that is in the K-12 program at UC Davis. Coming from someone who is a first-generation college student and really, I think, has had an uphill battle trying to make their place known into the academic arena and into nursing science, I know that I can do it, and I want to show everybody that the ideas that nurses can contribute are so impactful.